If this is the first time that you're finding my channel, thanks for joining. Please go ahead and like and subscribe so that other women who are searching for menopause solutions can find this information too. So my name is Kristine Groemping. I'm a family nurse practitioner and I'm NAM certified in menopause. And I'll also soon be board certified in obesity medicine through Obesity Medicine Association. So that is hopefully going to happen this year. I'll be attending their conference here this month. So today we're going to talk about perimenopause and sleep, or lack thereof. These dark circles don't lie. I have been not sleeping for a while now. I'm 39 and definitely in perimenopause. I'm having night sweats, difficulty sleeping, mood changes, you name it. I'm really sandwiched with that and postpartum and all of those hormonal changes. So my baby's 1 now, so hopefully that's kind of dissipating, but still really struggling with sleep. So the way I'm going to do this is we'll do the tip, the story, and then updates at the end if you want to stick around for that. So the tip is progesterone. So oral micronized progesterone before bedtime can help with sleep. Generally in practice, we use 200 milligrams daily, but for some women, 100 milligrams works. So, please talk to your medical professional. This is not medical advice. And if you'd like, you could also schedule a free consultation with me to see if this might help you. I think, like a lot of us, went to see my OBGYN. I was also concerned about preventing pregnancy. And so, I was started on birth control. So that's not wrong, right? I think, for a lot of us in our 30s, that's usually the go-to, even for some women in their 40s. The stories I hear is either they were laughed out of the office, they were dismissed out of the office without treatment, or, they were started on birth control and told their levels are normal. I have a lot of videos on the hormone levels, so you can definitely go and reference those, but just to say you can't diagnose menopause with labs or perimenopause. So caveat there is FSH can indicate that you're in menopause, but we don't use it to diagnose. So, I tried birth control. I gave it a real shot, tried different doses. It was giving me a lot of migraines, wasn't helping with my sleep, and it wasn't helping with my night sweats. And it was causing low libido, which is a side effect of oral estrogens, whether for hormone therapy or birth control. It decreases your testosterone level, and that can present with low libido. And so that was really causing problems with my partner. I discontinued birth control and I switched to progesterone 200 milligrams at night. I haven't started the patch yet. I'm planning to do that. But I can say that the first night I took micronized progesterone 200 milligrams was the best sleep that I've gotten since pre-adult when I had adult worries. Some side effects that I've noticed. Sleeping a lot better. I am sick, so it's hard to kind of tease that out, but I have been sleeping a lot better and staying asleep. So the going to sleep hasn't been so much an issue because melatonin and all the other things I've been trying, but staying asleep is the problem. Waking up at like 2, 3, 4, sometimes multiple times a night. And so staying asleep, falling asleep, also helping with moods. So I've noticed I'm a lot less anxious. And so it really just helps to like wind me down. And it's also helped me to kind of give up that glass of wine that I feel like I need at the end of the day to kind of wind down. So I haven't had a drink in like, I don't know, a week or so. And not that I like drink a lot, but I've got 2 kiddos. And so sometimes that glass of wine, especially for, stressed out moms, really need it, but it does interfere with sleep. And so although progesterone is not the magic bullet, it can really help. And then it makes it a lot easier to make those other changes. Like for me, not drinking wine, I haven't felt like I needed it because I'm getting sleep and I'm feeling better. My stress is lower. So that's my story. And, in terms of like contraception, I think I'm going to talk to my OBGYN about maybe pairing it with an IUD to prevent pregnancy. Maybe even talking to my husband about getting a vasectomy if we really don't want kids anymore, but we're in Texas and we want to make sure that we're safe. So, I think that's a personal choice for everyone, but those are some of the options. There's a lot of options out there. I have been able to give up the melatonin, which is pretty awesome. I was using that way too regularly. And then some of the downsides, progesterone can cause you to retain fluids. So you might feel like you're gaining weight. So, it would be you wouldn't want to go on a barbecue binge the week that you start this, right? Because of all the sodium. So just following that low sodium diet will help with that. Generally resolves in 2 to 3 months. For me, I haven't really noticed it that much. It can cause daytime drowsiness. I have felt that a little bit. It may also just be that I'm sick. So again, I'm just giving it some time, and I'm hoping that that starts to resolve. It is getting a little bit better, but I'm also sick, so hard to know. So we did the tip, the story, now updates. So I now have an in-person practice. I think we're officially going to be launching at the beginning of May. Right now we're doing the renovation, so working with a designer to create just like a really welcoming, chic environment. And so not like your sterile doctor's office. It's going to be more like an experience where you come in and you get to be heard and listened to, which I think a lot of us are missing in the women's health space. And so that will be available. I hear you. You've been asking for that in person and not just telehealth. So I'm making that available. So we'll be doing that in addition to telehealth visits. So offering both. The other thing is that I'm attending Obesity Medicine Association conference in April, and they're focused on women's health this year, which is really exciting. So I'll bring you all those updates when I come back. So that will probably be in May when I share that. Anyway, thanks everyone for joining. It's starting to rain, so I think that's our cue to end. All right.